My name is Cloma Clementina Fakona, and today I'll be presenting on a predictive analysis of diabetes risks using machine learning. Diabetes is still a major global health burden, claiming thousands of lives each day. Early detection is critical as it can significantly reduce the risk of severe complications such as cardiovascular disease, kidney failure, and vision impairment. This study aims to develop a predictive model that identifies individuals at risk of developing diabetes with the goal of supporting early interventions and more effective predictive care. The objectives of this study were to analyze patient health data and predict diabetes risks using machine learning, to identify the most influential features associated with diabetes, to provide visual insights into the patterns between risk factors and outcomes, and finally, to generate recommendations that can support healthcare decision making. I used a Pima Indians Diabetes dataset with 768 patients, and the dataset has features like age, glucose, BMI, blood pressure, insulin, and the rest. After cleaning the data, I split it into training and test sets. I then trained two models, logistic regressions and random forests, and evaluated them. Finally, I identified the most predictive features and used visual analysis to better understand the patterns. Logistic regression is simple and interpretable, but it assumes linear relationship between features. The random forest, on the other hand, is more flexible because it combines many decision trees and can capture complex nonlinear patterns in the data. From the results, random forests outperform logistic regression, achieving a higher accuracy and more reliable predictions. So I relied on random forests to identify the key predictive features. To determine the key predictive features, I used the permutation importance method. This technique works by shuffling the values of each feature and observing how much the model's accuracy drops. From this analysis, glucose emerged as the strongest predictor, followed by age and BMI. Other factors such as insulin, pregnancies, and skin thickness had little to no predictive power in this dataset. These findings align with medical knowledge since high glucose, older age, and higher BMI are already recognized as major risk factors for diabetes. These are some visuals that support the outcome. This violin plot shows the distribution of glucose levels in patients with and without diabetes. Individuals with diabetes have much higher glucose levels compared to those without diabetes. This aligns with medical knowledge and it confirms why glucose was identified as the strongest predictor in our model. This other violin plot shows the distribution of BMI by diabetes outcome. Non-diabetic patients cluster around a lower median BMI, while diabetes patients have a higher median BMI. This suggests that higher BMI is associated with an increased risk of diabetes. This histogram shows the age distribution of patients by diabetes outcome. Most younger patients are non-diabetics, while diabetes prevalence increases with age, especially from 35 years onwards. This supports the model's finding that age is an important risk factor for predicting diabetes. Finally, this scatter plot shows glucose versus BMI, colored by diabetes outcome. Patients with low glucose are mostly non-diabetics, regardless of BMI. However, when glucose levels rise above 140, the likelihood of diabetes increases significantly, especially in patients with higher BMI. This again confirms why glucose and BMI were highlighted as the most important predictive features in the model. Based on these findings, I recommend that predictive models like random forest should be integrated into early screening efforts within clinics. Special attention should be given to glucose testing, particularly for the populations at high risk. Lifestyle interventions such as healthier diets and increased physical activity should be strongly encouraged, especially for overweight individuals, since BMI was identified as a major risk factor. These are some limitations. The dataset used was relatively small and came from a single population, which may affect how well the results apply to other groups. Also, the data did not include lifestyle or dietary information, which are known to influence diabetes risks. Finally, the model provides probabilities of diabetes rather than a confirmed medical diagnosis. This means it should serve as a decision support tool to assist healthcare professionals, not replace clinical evaluations. In conclusion, this study demonstrates how machine learning, particularly random forest, can be applied to predict diabetes risks and identify the most influential factors, with glucose, age, and BMI standing out as the top predictors. Thank you.